All right, let's talk about something you've probably heard shouted in medical dramas or maybe seen on a hospital ID badge. We're going to decode those critical acronyms that are all about saving lives: BLS, ACLS, and PALS.
So you hear these letters all the time, right? But what's the real deal? What's the difference? It can definitely seem a little confusing, but once you understand them, you see this really clear, really smart system for emergency response. Okay, let's jump in and sort this all out.
We're going to start at the very beginning with the one certification that is the bedrock for everything else in emergency care. We're talking Basic Life Support, or BLS. So, what exactly is BLS? Well, think of it like the absolute first responder toolkit. It's not about complicated surgeries or anything like that. It's all about the immediate, life sustaining things you can do to keep someone going until the professionals with more advanced training can take over. And this is what's actually in the BLS toolbox. We're talking pure, hands on skills. You've got high quality chest compressions and breaths, that's CPR. You've got knowing how to slap on and use an AED or an automated external defibrillator. And you've got clearing a blocked airway. But just as important is what's not here: no medications, no IVs, no complex equipment. It is all about immediate, powerful action. And here's the really crucial part: BLS is universal. The principles are the same. You just adapt them for who's in front of you, whether it's a full-grown adult, a child, or a tiny infant. This is why it's the absolute must-have certification for pretty much anyone working in healthcare.
Okay, so once you've got that solid BLS foundation, what's next? Well, now we start to specialize. Let's start with the advanced care for adults. This is ACLS, or Advanced Cardiovascular Life Support.
Now, ACLS is a whole other level. We're moving beyond just keeping the heart pumping. This is about a systematic, almost step-by-step process. It uses these established clinical guides, or algorithms, to manage really complex and dangerous situations like a heart attack, a stroke, or other major cardiac emergencies. And I really want to drive this point home. ACLS doesn't replace BLS. Not at all. It builds right on top of it. You take all those fundamental skills you learned in BLS, and then you add this whole other, more complex layer of advanced medical care. This slide really lays it all out side by side. On the left, you've got your core BLS skills we just talked about, but then look at the right. Look at what ACLS brings to the table. Suddenly, we're talking about putting in advanced airways, reading heart rhythms on an ECG, getting IV access to give emergency drugs, and, this is a big one, leading the entire resuscitation team. All right, so that covers adults, but what about our youngest patients? This is so important because children are not just small adults. Their bodies are different. And that brings us to our third major certification, which runs parallel to ACLS. It's called PALS, or Pediatric Advanced Life Support. PALS is the specialized counterpart to ACLS, but it's designed from the ground up entirely for infants and children. The whole point is to give healthcare providers the specific skills they need to spot trouble early in kids and step in effectively when things go wrong. And the focus here is fundamentally different. See, with many adults, a cardiac arrest is a primary heart problem, but with kids, that's rarely the case. For a child, an emergency usually starts with a breathing problem. The heart is often the last thing to fail. That's why PALS puts such a heavy emphasis on managing respiratory distress and shock. The goal is to fix the problem before it ever gets to the point of cardiac arrest. Now, some things are consistent across the board. That target rate for chest compressions, 100 to 120 per minute, that's the magic number for everyone. But in PALS, it's all about the application. Everything from how deep those compressions are to the precise dosages of medication is meticulously calculated for a child's smaller body and unique physiology. And because of this specialized focus, PALS providers have a totally unique toolkit. They learn things like the Pediatric Assessment Triangle, which is a way to get a rapid, at-a-glance impression of how sick a child is. They use different algorithms for cardiac arrest, and critically, they are drilled on how to calculate drug doses perfectly, because for a small child, even a tiny error can have huge consequences. Okay, so we have our three main pieces of the puzzle. BLS is the foundation, ACLS is the adult specialty, and PALS is the pediatric specialty. So, how does this all fit together in the real world? Who actually needs to get which certification? This chart makes it pretty clear. See, BLS is the universal requirement. Pretty much everyone on this list needs it. From there, it all depends on the patients you see. A paramedic or an ER doc, they see everyone, so they need all three. A nurse in a cardiac ICU is going to need ACLS. A pediatrician, well, obviously, they're going to need PALS. It's a really logical system that gets the right skills to the right people. When you step back and look at it, these certifications, BLS, ACLS, PALS, they're not just letters on a name badge. They create an incredible chain of survival where every single person, from the bystander who starts CPR all the way to the specialist in the ICU, has a crucial role to play. It's a powerful, life-saving system, and it leaves us with a pretty important question. When an emergency happens, where does your role in that chain begin?